This interview is for information only and should not be considered as investment advice or a recommendation to buy shares in the company featured. Welcome to this Stock Box interview.
Joining us today is Clarissa Showenmi-Mokoka, the CEO of Oxford Cannabinoid Technologies. Thank you very much for joining us today again, Clarissa. How are you doing?
Very well, thanks, Mark, and thanks for having me.
Well, it's good to be talking to you. Of course, you announced something just this week, a move into oncology, developing cannabinoid-based treatments for cancer. And you've identified the potential for an immunotherapy agent that could be a first-in-class treatment for solid tumours. So, I mean, first of all, could you just perhaps tell me a little bit about this announcement and where it's come from? Because I believe a lot of it has come from your program 4, where you have this big database, don't you, of derivatives from going back quite far in history.
Yeah, no, that's absolutely right, Mark. So when we formed the company in 2017, one of the first things we did was we started to create a library of synthetic cannabinoids, derivatives of, THC, CBD, CBG, and so on. So we were building that library ourselves way before we IPO'd. And then in September of 2021, we in-licensed Canopy Growth's entire proprietary cannabinoid derivative library. So there are some 335, I think, compounds that we in-licensed from them, together with 14 patent families and, various other know-how and IP protection. So this announcement earlier this week is based on one of those compounds that we in-licensed from Canopy Growth. So it really is a demonstration of that licensing agreement really coming to fruition quite early on in the process. You all know that, we've been screening those compounds and looking at that library for the best opportunities that we have in front of us. And as you said, we're very excited to announce that, we've found what we believe will be a potential first-in-class immunotherapy agent for the treatment of solid tumours.
So this was it always the plan to go into oncology, but it was just, as you say, going through that library and finding the best opportunity?
Good question. I think essentially, we focused on pain to start with here at OCT because there's a huge unmet need. We've talked about that many times. But oncology is actually very close to lots of our hearts. Lots of people in the business have had impacts from oncology and friends and family members who have suffered with or perhaps even passed away from cancer. So I think it's a big mission. Everybody knows somebody that is suffering in that way. And so we've always been looking to see if there's something that we can do. And we strongly believe, as you know, in the therapeutic potential of cannabinoids and the fact that, frankly, they're as yet significantly untapped. And we're delighted to have made this discovery to really begin to advance, some more opportunities for cannabinoid-based treatments for different indications other than pain.
Okay. Well, I wonder if you can tell us a little bit more about how it actually works, because reading the RNS, you say that early analysis suggests that the agent has drug-like potential, including potency and selectively targeting cancer cells, and also indicating the possibility of developing a cannabinoid medicine to be taken at home as a tablet. So can you just explain a little bit more about what you're seeing, how it works, and how it might work in the field, in practice once it's actually developed?
Yeah, certainly. I mean, it's very early stage, so I must just say that, and we're excited about it, but, we are at the very beginning of what will probably be quite a long process of development. But in terms of what we say in the announcement, the studies to date, the experiments we've done to date have shown some great potential, great potency and selectivity as to the target. And the way this works is, if you think about the way that a solid tumour can affect your body, one of the ways it works and one of the ways it continues to grow is by switching off your own immune response. So the body's immune cells are unable to attack the tumour. That's one of the many ways that cancer does continue to grow. This agent we have identified is able, it seems certainly in vitro so far in the studies we've done, to switch on again the body's own immune response. So it's not actually attacking the cancer, the tumour itself. It's enabling the body to recommence what should have been going on the whole time, the body attacking the cancer itself.
So enabling, turning on effectively again the immune system so the body can fight the foreign object, which is cancer in the body.
Correct. Yeah, that's absolutely right.
Indeed. Okay. And this, I presume, hasn't come as a surprise to you, being the CEO of the company, but it certainly surprised me and perhaps the market, this sort of sudden announcement, because of course programs 3 and 4 were always perhaps on the back burner. We've been talking a lot about programs 1 and 2, but clearly a lot of work's been going on in the background. I mean, was there a breakthrough moment, would you say, or was it just something that's been building for a while and you've sort of just kept quiet about it?
Well, it's one of those things, isn't it, with drug development, Mark? You know, there are lots of points along the way where perhaps there's something that you could share and announce, but we really it takes a bit to get to the point where you're confident enough to say, yes, actually, the experiments we've done so far merits of making an announcement and sharing the news with people. Of course, you've got to be really careful in drug development, particularly in cancer, where you're looking at life-threatening conditions, not to give people, false hope. We wouldn't be announcing something that we didn't think had potential. So, Valentino and the team are very careful about the experiments they do and making sure we've got the right data behind what we're sharing with the market, because that's fundamentally what it's all about. We want to make sure we're getting, medicines into the hands of patients that need them as soon as we can, but not giving anybody any sort of false hope. That's not what we're in the market for.
No, indeed. But clearly the early signs there are showing confidence for you able to make this announcement. I hope perhaps I can do one of our special features with Dr. Valentino at some point, looking specifically at this new treatment here, Program 4, to get a bit more detail around what's going on in some of the research and the development curve. But I wonder if you can talk to me just a little bit about perhaps some of the current treatments that are out there in the market, and perhaps the gap that you're seeing and the opportunity where this Program 4 could slot in.
Yeah, sure. So, of course, we're all aware that we need new and more effective treatments for cancer. We certainly haven't solved cancer yet as a population. So, there's always a gap. There's always a space for new treatment. I think the thing that distinguishes this compound and this potential opportunity from what's already out there is that it is going to be, if all goes according to plan, much more convenient and easy for patients to consume. So taking a tablet rather than going and having an intravenous, drip of immunotherapy or other types of interventions like chemotherapy, radiotherapy, etc. And also in terms of the cost burden and the administration burden on the healthcare provider, such as the NHS, obviously it doesn't take too much to work out that giving a patient a pill to take at home is less impactful on the whole system than having somebody come into a specialist centre to, be delivered intravenous medication. So there's definitely a big gap, and I think there's always room in the market. I mean, the market size is extraordinary, sort of $532 billion by 2032, the immunotherapy solid tumour market, I should say. So, there's definitely space for new cancer treatments.
Oh, absolutely, and there will probably be for quite a long time. Now, of course, as you said, it's very early stage. You've got to go through that development process. But the idea of taking a tablet at home, it could perhaps sound a little bit too good to be true, but you're clearly feeling fairly confident about that in order to be able to actually say that. How are you going to move this down the development path now?
Yeah, absolutely. So good question. I think the next steps for us, as I've said, it is very early stage. So the next steps for us are some more in vitro and in vivo experiments before we can go to safety and pharmacology assessment later in the year, this year. And I'm hoping we'll be able to get to lead candidate stage during the year next year. These things, as with all drug development, do take time, but we're certainly excited to be at the beginning of what we believe is going to be a very interesting journey for this particular compound.
Indeed. And you say in the RNS it's all funded from the company's existing cash resources, so no concerns about funding the immediate advancement plans here?
No, that's right, Mark. So these initial experiments, aren't hugely cost sensitive. So we are able to fund them from the existing resources, and absolutely pleased to be able to make that advance and continue the development on those, as you said earlier, sort of earlier stage programs, whilst we are still pushing forward with the lead programs that we've got on deck.
Well, I look forward to hopefully speaking to Valentino and getting some more detail on this. Do you want to talk a little bit about the status of programs 1 and 2, just a quick update on where they are?
Yeah, sure. So program 1, I think you'll remember that we had MHRA approval to go into our first phase 1 in human trial for program 1, 461201, which is a CB2 agonist. It's targeting chemotherapy-induced peripheral neuropathy. So looking at a different problem that's related to cancer on the pain side of things. We have been making great progress on the administration and recruiting the healthy volunteers for that first phase 1. It always takes a bit longer than you'd expect. You know, I'm a bit of an optimist. So when we got that MHRA approval, I was sort of ready to go, like any minute now we'll be dosing and off we go. But of course, these things do tend to take a bit longer than we expect. But we do hope to be, progressing that very, very shortly. As I said, recruitment is almost complete and we'll be ready to administer our first dose shortly. In terms of program 2, again, that preclinical work has completed. Program 2, you'll remember, is our inhaled drug device combination. It's a THC and CBD combination, which is targeting another pain indication called trigeminal neuralgia, a very severe type of facial pain. So that is ready for the clinic. We've completed all the preclinical work, and we're just looking at what the next steps might be to move that one forward.
Excellent. Well, thank you very much. I did notice this morning in RNS you've increased your shareholding as well quite significantly, Clarissa. So it's always nice to see that from the market when you're in the cleansed period, I think it's known as, when you're able to buy shares. So clearly you're feeling pretty confident about the future of the company as well.
I'm feeling super confident. And, there are a number of us on the management team and the board who have purchased shares in the market. I understand that shareholders are keen to see that happen. I think, there are lots of ways that we demonstrate our support and our belief in the company as we go about our day jobs. But this is certainly an extra vote of confidence, I think. I'm, definitely very pleased to have been putting a bit more of my money into the company. It's a mission that I think I'm passionate about, and I believe we're going to be successful. Just going to take a little bit of time.
It always does, but that's good to see 1, 2 and 4 programs now up and running. So thank you very much for giving us that update. I'm sure we'll be speaking again soon. Clarissa Shomi-Mokoka, the CEO of Oxford Cannabinoid Technologies. Thank you for your time.
Thanks, Mark.
If you enjoyed this interview, then give us a thumbs up, a like or a retweet. Subscribe to us on YouTube or follow us on Twitter and hit that notification bell to be the first to know when we release new content. There's loads of great content on our website too, across all our programs at stockboxmedia.com. Thank you for watching.